for all age group, and also the Lund and Broader chart is there, which our doctors use to find out the percentage of burn surface area. Now we'll have a detailed discussion about why nutrition is important in the burn. Friends, nutrition is really important because all of the burn patients have significant metabolic derangements, and also for the wound closure and healing, they need good nutrition support. For pediatric age group, growth and development is another challenge. Now, the metabolic response in burn is really crucial to understand. And depending upon the hours of the injury, it is divided into three different phases. The initial phase is known as the F phase, which is from 12 to 24 hours of the injury, where the oxygen consumption, cardiac output, and glucose tolerance is decreased significantly. So the priority is to resuscitate burn patient on time and to provide them with the electrolyte therapy. The next phase is known as the flow phase, where which is from 48 to 72 hours of the injury, and there the oxygen consumption, resting energy expenditure, electrolyte losses, and cardiac output also increases drastically, and we need to provide good nutrition support before this flow phase begins. So it is important to take care of the nutrition part when the flow phase start in the burns. Otherwise, that will lead to some other serious complications associated with the poor nutritional support, like patients can lead to sepsis and severe infections also. The next phase is known as the anabolic phase, which is also called as the recovery phase, and it lasts up to 6 months or a year of the injury. In this phase, a patient need to be well hydrated, and the hypermetabolic state is there. So to cope up with the hypermetabolic state, we have to provide optimum nutrition support until almost a year. But the main long-term goal is to provide rehabilitation support and monitoring of the weight for burn patients. Now, what are the goals and objectives of the nutrition therapy in burn? So there are three major objectives behind the nutrition therapy in burn. First is to provide optimum nutrition support and to prevent muscle loss and weight loss, which is very commonly seen in burn patients. Also to promote wound healing and faster recovery for the prevention of infection and sepsis. These are a few of the guidelines which we recommend for the nutrition therapy planning. ISBI, International Society for Burn Injury guidelines for nutrition support are the cornerstones and the gold standard guidelines worldwide. Also, ESPN are the European guidelines. And nutrition care of burn patient chapter 12, which is written by myself in the textbook of plastic reconstructive and aesthetic surgery volume 5, which I will share in the future slides of mine. And I'll discuss about the protocol we follow at our center. So the ISBI guideline says nutrition support should be provided during the acute phase of recovery, and the enteral nutrition support should be used in preference of parenteral nutrition. The conventional oral diets or enteral feeds should be initiated as soon as possible. For patients with the burn covering more than 20% of their body surface area, a high protein diet should be used with the provision of adequate calorie to meet energy needs. An adult should receive at least 1.5 to 2 grams of protein per kg body weight per day, while children should be provided at least 3 grams per kg per day. The energy requirement should be estimated by the formulas that use variables such as burn size, age, and weight of your patients. And this is the European recommendation for nutrition therapy in major burns. And this is the chapter, this is from the chapter I have written for the textbook of plastic reconstructive and aesthetic surgery volume 5. And I have added all the macro and micronutrient calculation values here in this table. I would like to highlight here that apart from all these micro and macronutrient calculations, you have to take care of this thing that after achieving less than 10% of the total burn surface area open wound, zinc, thiamine, and folic acid with vitamin C, vitamin E can be discontinued. And now have a look about the protocol we follow at our center. It is the mix of all the above guidelines, previous guidelines I have discussed in this session. Adults, major bone patients, we prefer using Cariri formula for the energy estimation. And for the minor burn, we preferably use RDA with the addition of 10 to 20% extra calories. Protein we use by factor 1.5 to 3 grams per kg ideal body weight, depending on the percentage of total burn surface area. For children, we recommend Cariri Junior formula, which is actually age dependent formula. And for protein, we prefer the factor 2 grams per kg body weight to 3 grams per kg body weight up to 2 years. And for different age groups, it is a different factor. For micronutrients, I would like to highlight here that vitamin C supplementation is must because it helps in the collagen synthesis, as well as we need to provide additional dose of antioxidant to all the burn patient, major burn patients. Vitamin E should be supplemented by 400 milligrams per day for adult and by 100 milligrams per day for pediatric age group, while zinc for adults is 220 milligrams per day, and for pediatric it is 12.5 to 25 milligrams per day. Also, we add probiotic from the beginning of the hospitalization to all age group patients at our center. And I would like to mention here that the wound protein loss is really an important factor to add on until the wounds are open and not covered with the skin graft and homograft, because these open wounds loses a lot of protein and plasma which needs to be replaced on time, otherwise that will lead to the infection and sepsis also.